Good morning, ma'am. My name is Midwifery Npe, and I'm going to be your nurse for today. So today I'm going to be giving you health education about everything that happens after you gave birth. So I'm going to be telling you about how to look after the baby, how to look after yourself, and as well as the danger signs that you must look out for in case something goes wrong so that you can know. So firstly, as you know, after giving birth, you must always look for help. Just know that you are not alone, and even in the ward, if you need any help, don't be shy to tell the sisters. Also, when you get home, don't be shy to tell whoever's going to be helping you to look after the baby when you're feeling anything. And also, the hospital is a breastfeeding friendly hospital, so we promote exclusive breastfeeding for 6 months. And if you choose not to breastfeed, then you choose only formula, then you must also choose to formula feed exclusively for 6 months. So when we talk about exclusive feeding, then it means that you only stick to that feeding method. You don't give any water, you don't give any solid food, no porridge, and so forth. Especially when you are HIV positive. If you are HIV positive, then you have to breastfeed exclusively for 6 months and also give the baby the prescribed medication that the hospital prescribed. Okay, so with your baby, you must make sure that every 3 hours or every nappy change, you clean her umbilical cord, and you must also do buttocks care. That's when, after changing the nappy, you just put on cream just to check if there's no broken skin, no rashes or anything like that. Also with feeding again, when the baby is sleeping, you mustn't say, no, the baby is sleeping, so I'm not going to feed the baby. You must wake the baby up every 3 hours again and breastfeed your baby. Because if you don't, then the baby's sugar can go very low and the baby can sleep and get very tired and drowsy. And and also again, the other danger signs with the baby: if the baby is very cold, if the baby turns blue, and if the baby starts shaking as if they're having convulsions, then you must rush to the hospital. If your baby has diarrhea and your baby is vomiting every feed that they're taking in, then you must also take the baby to the hospital. So when coming to you as the mother, if you have a headache, blurry vision, also if your legs are swollen and you have pain on your left side or chest pain, then you must rush to the hospital as well, because that is a sign of preeclampsia. Preeclampsia can happen before and also after giving birth, and it's a very dangerous condition. Also, if after giving birth you feel very sad, you're crying all the time, and you have thoughts of harming you or the baby, that is signs of postnatal depression. So it is very normal in mothers who just gave birth. So with postnatal depression, you need to know that you are not alone and you mustn't feel like you're a bad mother. You must seek help at the clinic and also at home as well. If you're feeling overwhelmed, you must seek help from the people that you are staying with. If also you feel shortness of breath and you are breathing fast, you must also make sure to come to the hospital or report to the sisters in the ward, because it is a sign of pulmonary edema, which happens as a complication of after giving birth. Your heart works over time, and then it makes your lungs to get tired. Also as well, you must check your pad every 3 to 4 hours, and if you're getting a full pad in less than 5 minutes, you must report to the sisters, because that would be categorized as heavy bleeding, and it's called postpartum hemorrhage, which is also very dangerous to you as the mother. If also you notice that your wound is not healing and it is not closing well, it has discharge or it has a funny smell, then you must also report to the sisters, because it could be that your wound is not healing and it has an infection as well. Also coming to your legs, when you look at your legs and they are red in color and they are painful, and every time you step on the floor you feel pain, you must also report that, because it could be a blood clot in your leg, and it is called deep vein thrombosis, which is also very dangerous. So that you must report to the sisters. Also as well, before getting discharged, you're going to get a form that's called the proof of birth of the baby. So with the proof of birth, you need to go to Home Affairs before 30 days ends, because if after 30 days, then it will be a hassle for you to get the baby's birth certificate. Okay, so Mama